All right, so I wanted to share today about how kids and chiropractic are such a good match, and really how chiropractic can help kids to not just be healthier, but also how to thrive. So sometimes I get asked the question, it's like, well, why do kids need adjusted? Why would kids need to go to the chiropractor? And my first thought with that is, why wouldn't kids need chiropractic care? Especially kids today. When you look at this picture, you can just see how, no matter what age, kids are involved using a lot more electronics. Their heads are positioned down, how their bodies are positioned. More now than ever before in history, kids really do need to be taking care of their spines and need to be getting adjusted. When you really think about kids, like sitting at school throughout the day, the average kid is in class 6 to 7 hours a day, sitting at their desk. And a lot of kids probably look just like the kid in this picture, hunched back in their chair, their head going forward. And you could just imagine if you took an x-ray of them sitting in their chair like that, how their spine is, completely going the opposite direction. And then they may come home and spend 1 to 2 hours a day on the laptop, hunched over the table, looking forward. You can see that could just be straightening out that good curve in their neck, putting constant stress. And then they may spend 1 to 2 hours a day on their phone or playing video games or just TV time. And when you add that up, kids spend anywhere between 10 to 12 hours a day in positions that are actually damaging their spine and unhealthy for their nervous system. And when I think about that, it's like most kids probably spend more time at a desk, at a computer, on their phone than what the average adult does. So truly, kids probably need to get adjusted even more so than what most adults do, just because how their body's positioned throughout the day. When we look at how our body positioning affects our spine, this chart shows you how when you're looking down at a cell phone, the amount of pressure that causes on your neck. So when you're holding your phone somewhat up and you're looking at it, but you're not looking down, that still puts about 10 to 12 pounds of force on your neck. When you go to a 15-degree head tilt down, that adds 27 pounds of pressure, force on your neck. And then when you get to be in that 30-degree head tilt down, 40 pounds of pressure, 45-degree tilt, 49 pounds of pressure. And then when you're in the full all out, like looking down at your phone positioning, that can add 60 pounds of force onto our cervical spine, onto our neck. And just by looking around, you see most kids, that's kind of the position that they're in when they're on their phone. Their head is completely down, their body's folded in half, and they're putting maximum pressure on their spine and on their nervous system. So research that has come out about kids as far as why they need chiropractic care now more than ever. A third of U.S. kids, this was a study that was done in U.S. News, and they studied kids between the age of 10 and 18 years of age. And 1 in 3 of the kids reported having backaches in the last year. And the survey was done on 3,700 youngsters. And they found that the incidence increased with kids. The older they got, the more backaches they had. And those that played competitive sports also had more likelihood of having back problems and back pain. And you used to think of back issues as just being affecting older people, but what we're seeing is that it's affecting kids now, just because of how their bodies are positioned. And how you mold your spine, how you hold your spine throughout the day is really how you're developing your spine, how your spine is molding to become. So you see that kids that have bad posture, by how they're carrying their book bags or how they're sitting in class or on their laptops, they're more than likely going to develop bad posture throughout their life, which is a reflection of an unhealthy spine. And that's what this study talked about here, where it said, that kids that have back pain are more likely to be the ones that develop chronic lower back pain. that was actually this study right here. So association between your posture habits and low back pain, and prevalence of low back pain in teenagers is as high as what it is in adults. But what they found is that if they have low back pain in adolescents, there's a 4-fold increase that they will develop chronic lower back pain into adulthood. And I just think, like, why, if a kid is having in this position all day, why not get them adjusted? Because why set them up for a future of chronic pain when these are things that are easily fixed when they're young, and then they can grow up healthy with no pain, and just growing up on a track to be in better health, rather than being on a track to have pain pills and muscle relaxers and opioid issues. And you can just see the problems that we have in our culture with chronic pain issues. So but this study talked about how headaches in children, the prevalence is anywhere between 23% to 51% of kids are suffering with headaches. And that is not normal. Kids should never, ever have headaches. So if your child talks about how their head hurts or they have a headache, that should be a giant red flag that there is something going on with their spine, probably because of how they're positioned all day at school and on their computer or looking at their phone, that their neck is out of alignment, creating tension on their nerves, and that's what's driving their headaches. But you look at the rates of kids that are suffering with these problems, it's quite crazy. And then this was a study that was done with kids and chiropractic care. And they studied a group of kids, 200 children that were under corrective chiropractic care, and they studied 200 kids that were under conventional medical care. And they found out that the chiropractic group, they had fewer ear infections, fewer allergies, fewer cases of tonsillitis and asthma, and the health of the children under chiropractic care was demonstrably superior than the kids that received no chiropractic care, that were under traditional medical care. And I'll just speak to this for a minute, that I see this firsthand with my own kids, is that my own children have been raised obviously under chiropractic care since they were babies, and they have not been raised in the kind of traditional medical conventional care. And I've seen with my kids is that I don't think that they've ever had a maybe I can count on my hand 1 or 2 ear infections that I remember. But literally, I would adjust the boys when they say their ear hurts. I give them an adjustment. Maybe I'd adjust them 2 days in a row, and their ear infection was gone within a couple days. No need for antibiotic. No need to go to urgent care. We get them adjusted. Their body clears that ear out. It drains better, and it's done with. And I see that a lot with my kiddos, is that they've never taken Tylenol. They've never had an antibiotic. And really what we reserve the medical system for is for crisis care. That's the only time that we go the medical route. Everything else, we get them adjusted. I may use some essential oils. We may look at some type of a supplement to give them if they're having trouble with something. But there's no need. I really see no need besides a crisis. If they fell and split their eye open or cut their finger, we're going to go and get medical type of care for that. But most things, you find that through chiropractic adjustments, through certain types of working with essential oils, that a lot of things you can avoid going the medical route altogether. And 95% of kids that are born infants, 95% of infants have been found to have misalignments after birth. Just the process of being born, going through the birth canal, being pulled or twisted, or a hard, difficult labor, or being born via C-section. Chiropractic, those kids need to be checked after birth. And chiropractic is shown to relax the muscular tension, to improve sleep. It can reduce colic symptoms. It improves breastfeeding outcomes in newborns. And it helps babies with their bowel function. Babies poop better after they've been adjusted. I've seen this with moms that have trouble with the baby latching on and that not wanting to breastfeed very well. And we work on their adjustments of their spine. I could even do a little work on their cranial bones or up in their palate. And it night and day difference with them being able to latch on and nurse better. Babies sleep better when they're adjusted. It helps them to sleep throughout the night better, helps with fussiness and colic, and then helps to prevent and treat ear infections as well as improve their immune system function. Kids that are under regular chiropractic care, they get sick less often, they have less allergies, less asthma. Overall, their body is functioning at a higher level because their nervous system is clear, their brain and their body are fully connected, and they're just able to really thrive and be at their best. Chiropractic care, just some benefits for children and adults. Helps to improve your health, improves your sleep, helps to improve your body's ability to handle stress. It improves happiness, your overall well-being. It strengthens your immune system, helps to improve the quality of your life and improve your mobility. Chiropractic care has also been proven to decrease your incidence of disease, to decrease illness, to decrease pain, decrease achiness throughout the body, injuries. It helps with decreasing your bad posture, helps with depression, decreasing depression rates, helps with decreasing the amount of prescription drugs that you take, and it also decreases anxiety. And we see this is big for children today. I think that the pandemic and everything and the schools and just everything that kids had to go through, I think you will see more anxiety in kids, more depression in kids. And chiropractic care can just help to calm their nervous system and help them deal with everything that they have to deal with in today's world. So why should you take your kids to the chiropractor? Why should you get your kids adjusted? These are kind of tidbit big reasons why parents do take their kids to get adjusted here, why you see parents bringing their kids in to get them adjusted. One is that it maximizes and increases the child's brain and nerve development. It can actually improve how the kid's brain develops and how their brain works. It just opens up that brain-body connection. It helps to enhance the child's overall well-being. Kids feel better, they're happier, their bodies, it just takes all that internal irritation off their system so they can be at their best. It helps to strengthen their immunity and reduce their incidence of colds, earaches, and general illness. Helps with colic and irritable baby syndrome. Helps with asthma, difficulty breathing, allergies. I see that a lot with kids that have asthma problems, breathing problems, allergies. Those things all improve with chiropractic adjustments. It improves their posture. That's big. Line up 10 kids and you look at their posture, a majority of them you'll see their shoulders are hunching forward, their heads are hanging out in front. At young ages, they already have bad posture. And chiropractic adjustments helps to improve that. It improves a child's ability to concentrate. It is great for helping things like ADHD, helping to focus, helping to learn better. And it assists with behavioral disorders and offers greater emotional well-being when kids are adjusted. So anytime I hear kiddos that have trouble with anxiety, depression, I know that in my heart, those kids need to be adjusted. It's going to help them just to be able to have better emotional well-being. And then it helps to alleviate bedwetting and digestive issues, digestive problems. My boys that I've adjusted since they were young, they've never had a problem with bedwetting. And I think that that's a very common thing. A lot of parents, they have trouble with bedwetting, especially with boys, I think. But my kids, as soon as their diaper came off, they slept through the whole night and really never, ever wet the bed, even when they were 3 years old. So I do know that getting kids adjusted helps that brain and body connection. It helps them to wake up when they feel like they have to go to the bathroom and not sleep through that. And that's huge, not having to deal with the bedwetting problems with kids. And then helps to assist with sleep issues. You ask a lot of parents, their kids have trouble going to sleep. They're putting their kids on melatonin. And just getting those kiddos adjusted can help them to sleep easier, sleep deeper, and just overall help them function better. So when it comes to kids and chiropractic, I really Okay, I think I'm back. Sorry, I lost a little bit of my video there. But with kids, with chiropractic, what I do recommend is if you haven't gotten your kids checked, spring break coming up is the perfect time to do that. I know, just talking with parents, you may want to get your kids in here, but their schedules are just busy. They got sports, they got all those things. But spring break coming up is a great time to bring them in. During the day, we'll set up that appointment to get their checkup and to see what their spine looks like and map out getting them adjusted and helping them to have all these benefits that they can have through getting under chiropractic care and just helping them to thrive and grow up healthy. So we can look at scheduling up that appointment to get them in for the month of March for Friends and Family Week. And we'll make it easy. You know, kids most times don't need to be coming in 2-3 times a week. A lot of kids do really well with a weekly adjustment. Even every other week is a good general maintenance frequency for most kids, just to help their bodies function better, feel better. So let's get those kids adjusted. Let's take care of them and make sure that they're growing up healthy, and that they can just thrive in this world today.